Polio cured. 72 hours or less. Simple injections of vitamin C. No further maiming. No more epidemics. Shockingly, there were no questions, no challenges, no suggestions to investigate the protocol, not even a question from those doctors in attendance. It is noteworthy to mention that a Dr. Jonas Salk and a Dr. Albert Sabin were well into their work to develop polio vaccines at this time. 8 years later, in 1957, when the polio epidemic was already over, Salk announced his injectable vaccine to the world. 13 years after Dr. Klenner reported his polio cure, Sabin licensed his oral polio vaccine, the Sugar Cube. I can hardly describe the flood of emotions that came over me when I first came across Dr. Frederick Klenner's work with polio patients. The fact that the polio virus was so easily eradicated by vitamin C was not surprising. My own successful experience in using high-dose vitamin C with a number of different medical conditions had already convinced me of its potent virus-killing abilities. What overwhelmed me now was the new realization that vitamin C had been shown to cure this disease before countless people had been killed or crippled by it. Even now my heart aches when I see the pictures of polio victims in iron lungs, wheelchairs, and leg braces. And then I get angry. If just a few in the medical community would have opened their eyes, it could have been much different. This criminal negligence should cause the researchers, politicians, drug company executives, government officials, and physicians who have fought to keep vitamin C out of the mainstream to keep their heads in shame. Yet, in the words of the obnoxious TV infomercial announcer, but wait, there's more. Herpes infections and high-dose vitamin C. In 1936, scientists published results of groundbreaking research establishing vitamin C as a potential treatment for herpes virus infections. Their research clearly proved that vitamin C is a powerful virus-killing agent. It kills every known herpes virus for which it has been tested upon contact, including the kind that causes shingles. Additional testing confirmed their findings the following year. Still, other studies have further validated the findings. Shingles, a type of herpes infection, develops from a reactivation of the chickenpox virus, often many years after the initial experience with chickenpox. The lesions that result from shingles are very painful and can persist for weeks. Over 50 years ago, a medical doctor was able to resolve shingles outbreaks with a daily combination of 2 to 3 grams of vitamin C via injection with another gram given orally. Perhaps the most impressive study of high-dose vitamin C in shingles was published in 1950. The researcher reported a complete resolution in 327 out of 327 shingles patients treated with intravenous vitamin C, all within 72 hours from the start of treatment. What are the chances your doctor will recommend high-dose vitamin C if you were to walk into his office with a full-blown case of shingles? If your doctor is a traditionally trained MD, I can safely say there's no chance. Why? Because the use of high-dose vitamin C was conspicuously absent from his medical textbooks and continues to be absent to this day. In other words, he doesn't know. AIDS and high-dose vitamin C. Although at present there is insufficient evidence to make a strong curative claim for high-dose vitamin C in the treatment of AIDS, many vitamin C studies show positive results in treating this disease. In 1990, Robert Cathcart, MD, reported his experience in the vitamin C treatment of over 250 HIV-positive patients, including ones with full-blown AIDS. In this article, he noted that clinical improvement for any given patient seemed to be dependent on 2 major factors. 1, the amount of vitamin C given, and 2, the level of illness at the beginning of treatment. He asserted that any AIDS patient could be put into remission if enough vitamin C were taken to neutralize the toxicity produced by the virus and adequately treat any secondary infections. Basically, Dr. Cathcart routinely contained the HIV infection, allowing most of his patients to live out a normal lifespan in an asymptomatic state. Although not technically a cure, his patients peacefully coexisted with their infections. Vitamin C can also prevent and cure non-viral infections. A considerable list of bacterial, parasitic, and other non-viral infections continues to plague mankind. Many respond poorly to antibiotics or do not respond at all. Even here, vitamin C has been shown to prevent, speed recovery, and even cure many of these infections. See Resource H for details. Here's a partial listing: diphtheria, dysentery, leprosy, malaria, pertussis, pneumonia, pseudomonas infections, rheumatic fever, staph infections, strep infections, tetanus, trichinosis, tuberculosis, typhoid fever. Researchers report that all of these diseases create a deficiency of vitamin C in the host. This happens because all pathogens produce excess oxidative stress, depleting available blood and tissue levels of vitamin C in the process. As has been reported for viral diseases like polio and encephalitis, when extremely large doses of vitamin C are used to combat the infection, immediate and curative results almost always ensue. And even when small doses are employed, vitamin C will often noticeably improve the patient's condition. Remember Alan Smith's case, where his rate of improvement dramatically slowed when his doctors inexplicably dropped his daily vitamin C from 50 to 100 grams to 2 grams. However, this will not always be the case. Often a complete clinical relapse will occur when vitamin C dosage is reduced too early and too drastically, allowing viral or microbe titers to rebound. Furthermore, it is clear that a certain blood concentration or tissue saturation of vitamin C is always needed before a positive clinical response can be observed. So when tiny doses have been tested against many different infections, researchers often report that vitamin C had no positive clinical effect. Many seemingly unethical studies appear to have employed this fact to discredit vitamin C's efficacy by purposely testing with very small amounts. The researchers then conclude that vitamin C was of no value at all, rather than just ineffective at a tiny dose. Conclusion: consider these facts. Traditional methods of preventing and treating many infectious diseases are woefully inadequate. Pathogens always deplete vitamin C levels in the body. See Resource H. Even when insufficient doses of vitamin C are used, the outcomes of many infectious diseases have been greatly improved. When high-dose vitamin C is employed, incurable infectious diseases are routinely cured, e.g. polio and viral encephalitis. Vitamin C fuels and empowers the immune system in many different ways. See Resource B. Unlike antibiotics and vaccinations, vitamin C has no unhealthy side effects. See Chapter 7. Vitamin C has no known toxicity. See Chapter 7. The argument for employing high-dose vitamin C in the treatment of infectious disease is overwhelming when the evidence is actually reviewed rather than arbitrarily dismissed as simplistic or unbelievable. A thorough review of Resource H will make an even more compelling case, and yet the traditional medical community flat out refuses to use vitamin C. Some researchers and clinicians claim there is a purposeful stonewalling against this natural substance. Why? I must leave that to the reader to determine, but unless the public collectively demands the incorporation of high-dose vitamin C into the routine practice of medicine, we will all be saddled with vastly more expensive, less efficacious, and decidedly toxic drugs and therapies. As Dr. Klenner said, ascorbic acid, vitamin C, is the safest and the most valuable substance available to the physician. Many headaches and many heartaches will be avoided with its proper use. End quote. Finally, if high-dose vitamin C were only efficacious for the prevention and treatment of infectious disease, that alone should be sufficient to recommend its universal use in the practice of medicine and as an essential supplement for the population at large. But vitamin C's value extends far beyond its unequaled antimicrobial properties, as you'll soon see.